What's up, Foxy People? Welcome back to my channel. I know this video is long overdue. I should have gotten it out to you over a month ago. I struggled. I got into a funk. I'm kind of planning on doing a separate video about all of that, but during the lockdown, I really got into a depression almost. And then I just got out of it, just got back to work, and then I was off of work for a month. So I kind of got into a funk. Even going back to work, I've been focused so much on going back to work and catching up on everything. And then on my days off, I kind of just didn't want to do anything. So I'm very, very sorry that this is so overdue, but we're getting it done today. So this is part 3 of my medical journey. I will leave part 1 and 2 linked in the cards as well as down below. Part 1 was basically my symptoms and all the stuff I've been going through for years. And that video ended without a diagnosis. And then the second video was my journey to getting a diagnosis, as well as like all the tests and stuff I had to get leading up to surgery. Now this video is going to be kind of like a vlog, although I didn't get as many clips as I was planning on. I wanted to kind of vlog every day in the hospital while I was there for a week, but I had a 90-year-old roommate next to me and she slept a lot during the day. I was on a lot of medication and I slept a lot, so I didn't get many clips. I have a couple clips from the first and second day and that's about it, as well as like preparing and going into the hospital. But I did write down everything, so I am going to tell you how my week went, as well as what's been going on for the last 2 months. So let's get into my surgery and recovery journey. Hey guys, it's 5:30 in the morning on August 16th. I'm up because I am going to the hospital. I have to be there for 6. Surgery at 8 o'clock. So here's the beginning of that vlog, I guess. I wanted to give a little pointer on something I think is, I can't say I found it helpful because it hasn't happened yet, but something I did ahead of time to make the process easier, I think. I'm assuming because of the large abdomen incision and the leg incision, I'm not going to be wanting to wear like any tight clothes and stuff, right? And my husband, as great as he is, if I asked him to find me comfy clothes, he would end up coming with like see-through leather type pants or something like that. Like, let's be honest. So instead of having him choose through all this, what I did was I just put a basket together of all my different jogging pants and pajama pants, yoga pants, loose fitting t-shirts, all that kind of stuff. I'm only bringing, if you saw my hospital bag, I'm only bringing one outfit, because I'm assuming I'm not going to be wanting to wear, I'm assuming I'm not going to be wearing many clothes, so it's probably just going to be a hospital gown. So I brought one outfit just in case, and if I do need more now, he can choose from that as well. When I get home, I will be sleeping on the main floor in our computer room, because our room's up in the attic right now, and I feel like that's going to be way too many stairs to climb. So I'm going to be staying in the computer room. So when I get home, this basket can just come down to the computer room, and I can have my clothes there. So I'm very shaky. I'm sorry I didn't eat anything all day, and I've slept maybe an hour last night. So let's go to the hospital. So I got about 5 minutes till I have to go in for like checking in the admitting area. The nerves are starting to kick in. It's more anxious than anything. Like, I'm anxious about the unknown. I'm worried about how recovery is going to be. And honestly, I'm so anxious. I don't know how to live life without pain. So that's what I'm feeling right now. Let's get in there. So right here, I'm going to read off the surgical report. My surgeon has been phenomenal in answering any questions, and he knows that I have this whole idea of my awareness campaign for Nutcracker Syndrome, Pelvic Congestion Syndrome, and all of that. Excuse me, which I will be working on very, very soon. I just wanted to get my journey done, and then I'm going to do a more generalized thing, which I talked about in part 2. So this is what he explained to me as to what the surgery actually was. As promised, here are the basic steps to the operation. Midline incision and enter the space where all the organs sit. Retract the intestines down and to the right, either outside the body in a moist towel or inside the body if there is room. Open the lining of what is referred to as the retroperitoneum. Find the left gonadal vein and follow it up to the left renal vein. Dissect and clean up the left renal vein. Then there are a few options. Keep the left gonadal vein attached to the renal vein, but dissect it all the way down and then swing it over to connect it to the IVC. This is called left gonadal vein interposition. If the left renal vein is long enough, tie off all its branches, including the large problematic left gonadal vein. Cut it off where it joins the IVC and move it down and reconnect it onto the IVC at a different angle to prevent compression by the SMA, superior mesenteric artery. This is called left renal vein transposition, which is one of the most common surgeries for this. If none of these are good options, remove a piece of vein from the thigh, the great saphenous vein, and use it to bypass the left renal vein. That is the surgery I had. Once the bypass is done, we ensure there is no bleeding, return all the organs to their proper place, close the abdomen and skin. Some photos of my insides, and I'm going to let you know that it is very graphic, so warning now if you have a very weak stomach and you don't like blood and stuff like that. It's literally my veins and inside my abdomen. So if you can't watch that, I'm going to put a timestamp right here, and you can come back to it after I show the video. So here is your warning. 5, 4, 3, 2, 1. So this vein right here is the left renal vein. This is my kidney. And this one is the gonadal vein that I was talking about. So he tied it off right here. That's where it was compressed, but you can see how enlarged that vein is. Crazy, crazy. So my surgery was scheduled for 8 a.m. and I actually didn't wake up in recovery until 6 p.m. Now, if you are having the surgery, that is not normal. I had some sort of complication during the surgery. We still don't know what it is, but basically there was some fluid floating around and they had no idea where it was coming from. They thought maybe it was my bladder, so they called the urologist in. I had a cystoscopy to check for any problems with that, as well as I had a stent placed, and I had that for the entire week that I was there. And then I also had a drain inserted in my abdomen, which you will see in one of the clips, I'm pretty sure. And it was draining out all that extra fluid. There was nothing wrong with my bladder, nothing wrong with anything. We could still have no idea what it was. My surgeon says that he thinks we just pissed off my pancreas and from jumbling it all around and stuff. So it was kind of just spewing out some fluid. The drain, so it almost looked like a rubber plastic grenade. That's exactly what it looked like. And it would have to get drained out and emptied. Like, it would drain out from my stomach into this like grenade. And the first couple days, it literally looked like a strawberry kiwi milkshake. Like, it was so red, kind of pinkish, and like thick and creamy. It was weird. And then over the week, it kind of went orangey and then peachy and then clear. And it slowed down the draining as well. When I woke up from surgery, I had like 6 tubes that I was hooked up to. I do remember I had something. It was like almost like a little machine, or it was, I don't know. I was so out of it when I woke up in recovery. But I do remember something being placed on my wrist, which they took off immediately. So I don't know if it was like blood pressure or something. Like, I did have a puncture wound from it, so it was attached pretty well. I don't know exactly what it was though. So when I woke up, I had the oxygen, of course. I had an NG tube, which was draining out my stomach. Terrible. That was the worst thing ever because I could feel it in my throat. And I also talk about that in the one clip that I have. And then I had my drain. I had an epidural. It wasn't like a pregnancy epidural. Like, it wasn't at the bottom of my spine. It was more up. It was numbing because they were working on my kidneys. It was numbing that kind of area. So I had that, and then I had a catheter, and I had an IV. My husband thought it was funny. Like, every day, every morning, he would text me and be like, how many more tubes have we lost? Because it felt like every day I was getting rid of another wire. So Monday, which was my surgery day, I don't have any clips from after surgery. I do have, obviously, the ones you saw of me going into the hospital. I slept, like I said, I woke up at like 6 in recovery, got up to my room. My husband came and dropped off my bags and whatever, and then I just slept for the rest of the night. So I didn't get any clips that day. So then Tuesday, which would be day 1 post-op, is where I got my 2 clips from. So I'm going to roll those real quick, and I'll be right back.
Hey guys, it's the 17th. I didn't update you at all yesterday because I was just sleeping pretty much the whole day. And I've been sleeping pretty much all day today too. The freezing wore off about 3:30 this morning. So I was in a lot of pain. I've been in more pain today than I was when I woke up from surgery. So we've had to stay on top of pain shots every 2 hours. But if we even go 10 minutes past the 2 hours, the pain is like tremendous. This stupid thing in my nose is so annoying. But my stomach was draining stuff. So we're going to test it in half an hour, see if it's still draining too much. And if not, I can finally get it taken out and eat and drink something. The worst part about it is I can feel it in my throat. Anytime I swallow, I can feel it. I also have a drainage thing. There is a complication with mine that there was fluid around the kidneys, around the urethra. Anyways, they had to call in a urologist, and everything seemed fine. They couldn't find the problem, so now they're just draining it out. But besides that, like, my normal day-to-day pain is gone. The pain today is terrible, but if it means my normal day-to-day pain is gone, I'll take this, what I'm going through, for the next day or two, and I'll be fine. Hey, so it's still the 17th, but it's 20 after 9. Finally got the NG tube out, so that feels so much better. I'm only on the liquid diet right now though, but it's still, it it's better to drink without the NG tube in. That thing was brutal. I could feel it in my throat. They just want to make sure that my stomach is okay because it was kind of jostled around and stuff. Still have my other drain in though. And then they just upped my epidural. So that seems to be helping, along with the 2-hour morphine shots. I've kind of just been sleeping the entire day away. Because when the pain does kick in, if I don't stay on top of the pain meds and the pain kicks in really bad, honest to God, the pain feels like every single one of my ribs are broken in 3 places. It's bad. But if this is, like I said, if this is going to be the fix after all these years, then I'll be glad I did it. So I'm just going to keep sleeping away. Hopefully tomorrow is a better day. So this is my incision day 1. Obviously it's covered with the bandage. Same thing with my leg incision.
So Wednesday, August 18th, which would technically be 2 days post-op, I slept most of the day still. My pain med, I was getting, so not only was I on the epidural, which had pain medication in it, I was also getting morphine shots every 2 to 3 hours. So it was like, I'd get my shot, I'd be awake for half an hour, I'd sleep for an hour, not even awake, sorry, I'd get my shot, I'd fall asleep almost immediately, sleep for about an hour and a half, and the meds would start wearing off, so it would kind of wake me up, and I'd be awake for like half an hour, get my next shot. Within an hour or so, these nurses, oh my goodness, my heart goes out to them. Like, they were constantly short-staffed. They have been put through the ringer through this whole pandemic, and our government in Canada did not help them out in any way, shape, or form. They did not allow vacations, and like people were literally call in sick every night because they're just drained. They're overworked, and they weren't getting compensated for it. Like in the States, I guess they were getting like an extra $200 if you would work on days that weren't yours, kind of thing. But here, because they were so overworked, nobody wanted to pick up extra shifts knowing that they're going to be short-staffed and they're going to be stressed out, right? So unfortunately, all of my pain meds were late. So that was basically my medication routine for the first couple days. So I slept a lot. My surgeon would check on me every morning. I was still getting a lot of pain every 2 hours, and this medication wasn't working that we thought. So he decided that we were going to up my epidural. But upping my epidural caused my entire left side to go numb, like from my ribs to my knee. It was completely numb, and I couldn't get up and walk around. I couldn't get up and use the bathroom. Like, I had a catheter in, but I had started eating solids at that point finally. So obviously I still needed to go to the bathroom for other things, and I couldn't get up and do that. The physio team came by and had me sit up on the side of the bed. It pulled on my abdomen muscles, but it really wasn't too bad. It was like the first time kind of sitting up and moving those abdomen muscles. It wasn't comfortable, but it wasn't super bad at all. My recovery actually, surprisingly, was not as bad as I thought it would be at all. But again, with my whole left side being numb and not being able to move it, I couldn't really even do the physio exercises that they wanted me to. So they were going to come back in a couple days. So my surgeon decided that Wednesday night we were going to take my epidural out because they didn't like that it was causing my whole left side to be numb. And it seemed like it wasn't working, considering I still needed the pain shots every 2 hours, even though the epidural had fentanyl in it, which is a very strong pain medication. Now the problem is, I've been dealing with this for so long that I've been prescribed Percocets, and I've been on them for 5 years. So my body is immune to pain medication. Obviously not as strong as fentanyl. That's crazy, and morphine and stuff. So we did go into this feeling like I might have a little bit of issue with the pain medication. Obviously, if your body is not already kind of dependent on pain medication, you are not going to have this struggle, right? So anyways, we took it out Wednesday night, thinking that obviously it wasn't working. And let me tell you, it was definitely working. It was doing something, because by the time that epidural wore off, oh my goodness, like I would say Wednesday night into Thursday morning was my worst night the entire week that I was in there. And it was just because I was finally feeling everything that they had done during surgery, like Monday, Tuesday, and all of Wednesday, like up until we took it out kind of thing. It was all numb still. I didn't feel the procedure. I didn't feel the surgery pain kind of thing, right? So it was just that initial feeling of all the numbness wearing off and finally feeling everything. That was by far the worst of it. I started feeling like these gas bubbles, and it was very painful gas bubbles. Like it wasn't necessarily gas bubbles, but that's exactly what it felt like. So I couldn't walk to the bathroom still, but I was able to have the commode put next to my bedside, and I was able to get myself onto that and try and get my bowels moving again. But after like 4 days of not moving them, it was a struggle. So that was it wasn't painful. It was just very uncomfortable, I would say. And it's like you're kind of training your body all over again to use the bathroom. Like I was only on a liquid diet the Saturday before was the last time I actually had like solid foods. Because Sunday, my surgeon, at least, it's not a requirement, but my surgeon prefers that you only have a liquid diet the night before. And then obviously you can't eat after midnight. But he prefers to just have a liquid diet because it makes it easier for surgery, since he has to move around your stomach and your bowels and all that. He doesn't want them full, right? Which totally makes sense. But it sucks because I was so hungry on Sunday. So I didn't really have any solid foods Sunday. Didn't have anything to eat Monday. I slept the entire day basically. Tuesday I was on a liquid diet for the majority of the day because I still had that NG tube in. It wasn't until like Wednesday dinner time that I actually started eating solid foods, and I ended up getting I remember I got a chicken Caesar salad because it's my favorite. I love eating it, but it did not go down well. The dressing or whatever, the acidity of the dressing, it was just really hard on the stomach after not eating for 4 days and stuff. So I would suggest to start small, soup, toast, that kind of stuff. Don't go all out. You will regret it. So those gas bubbles that I had were kind of my biggest struggle through the whole thing. And again, not even painful really, just really uncomfortable. And my surgeon explained it to me. They had to literally lift out my bowels and stretch them out to the side so that they had room to move around. Obviously, I have a very small frame, so there's not a lot of room to move around in there. So he said they literally had to yank my bowels out and then shove everything back into their spot. So that's where, like I said, it's not actually gas bubbles, but it feels like it. And it's just everything kind of settling back into place and getting moving again and whatnot. That's how he explained that to me. So Thursday morning, the 19th, when my surgeon came in at 7:30, 8 o'clock to do his daily check, I was having a lot of pain in my left side, a ton of pain. Like I said, Wednesday night into Thursday was the worst. And it actually really worried him because the left side, the left kidney is where he did the work, right? So it kind of worried him. He wanted to send me for blood work and a CAT scan. He said if it was still like that the following day, Friday, then we would go for the CAT scan and whatnot and see if maybe the bypass was failing and anything like that. Like he wanted to give me the day to see if it was just the epidural or if there was a serious problem. But we did do blood work that day. So we leveled out my pain meds. I got to a comfortable place in the afternoon, and I forced myself to get up and start walking around to hopefully move these gas bubbles around and get them gone. And that was the best thing I could have done. So if you are having this surgery, as soon as you feel like you can, not even that you can, because I would have been fine laying in bed all day, but my legs were working. I wanted to get out of the hospital, obviously. So I knew I had to force myself to do this. And like my medical team was great. My surgeon was awesome. He let me do kind of whatever, like take it at my own pace almost. Yeah, I forced myself. I ended up doing 2 laps around my floor that day, holding onto my IV pole. I was like walking all hunched over, very, very slow. But again, I hadn't even moved my legs in the last 5 days. So even getting those muscles up working was an issue. And doing that, moving those gas bubbles around and kind of like removing them and stuff, relieves so much pain and discomfort that we obviously realized that that excruciating pain that I was dealing with throughout the night and that morning was obviously just from the epidural wearing off and finally feeling everything. So Friday morning, the 20th, things were getting so much better. The pain I was feeling, I explained it as like, I felt like I did 1,000 sit-ups. That's what it was. It was like muscle soreness more than anything. Exactly, I felt like I did 1,000 sit-ups. Or like my surgeon says, like I told him that and he's like, or like we just cut into you and did some work. I'm like, yeah. Like cut through all your abdomen muscles? I'm like, yeah, I guess so. But like I had such a thought in my mind going into the hospital that this was going to be so painful, and like just even feeling the incision pain and stuff, that kind of healing was going to be so bad. And it really wasn't. Like I said, it felt like gym and like workout discomfort was the extent of my pain through this whole thing, besides Wednesday night when the epidural wore off. So I was up walking around a lot more. I was basically doing everything by myself. I was able to go down to the cafeteria by myself and just walk around the hospital. The more walking I did, the better I felt, because it was moving things around and relieving those gas bubbles that I was feeling, going to the bathroom, all that stuff. I was basically independent. Still had my IV pole, so I still had to walk around with that, but at least I was walking up straight. I wasn't all hunched over, and yeah, I was doing pretty much everything on my own. And then I'd come back to my room when I needed my pain meds and take a little nap for like half an hour and then get up and do it all over again. However, I still wasn't eating any full meals yet, because at our hospital, you can pick what you want for lunch and dinner, but breakfast is kind of generic for everybody. They just send out the same thing for everybody. And I don't think one day I ate the breakfast. Like it just wasn't good. I didn't like any of it. So I would get up and I would go down to the cafeteria and get myself whatever I was feeling. And then for lunch and dinner, I would order things, but I would still only pick at it. Like my stomach was still shrunk. So I wasn't able to eat any full meals until Friday. I finally ate a full sandwich for lunch. I was so excited, and I was so proud of myself. So nothing really else that day. It was just a lot of sleeping and walking. Like walk as much as you can. Walk, walk, walk. Get things moving. Get up and like get your life back almost. I feel like the quicker you can do that, the quicker you'll get out of the hospital as well. Because not only are you recovering and you're healing your body, but you're showing your doctor that you're healing your body and like you can go home and recover at home, right? Like I was only there, I would have been released on Friday, but he wanted to keep an eye, just because I did have that pain. He wanted to keep an eye on it for a couple more days, and the hospitals here don't usually release on the weekends. So the plan was to go home Monday, because I still had that stent. We had to keep an eye on the stent. Obviously, don't push your body. Don't do anything that's going to make it worse on you. Like when I felt like, okay, my body has had enough walking, I'd go back to my bed and lay down, watch a show, whatever. Like I don't want to ruin my body or make anything worse, but I know I wanted to kind of escalate recovery as well. Friday, when I was walking back in from one of my outside strolls, I hit a curb and knocked my IV bag loose. And at that point, it was only saline anyways. I wasn't getting medication actually through the IV. It was just saline solution and some antibiotics earlier. But at that point, it was just the saline solution. So my nurse decided to just unhook me altogether. And if I needed to have any antibiotics or whatever, then we would just hook up the bag because I still had the port in my hand, but I didn't have to walk around with the actual pole anymore. Saturday the 21st, now that I was up walking around and being independent, I was able to go outside and have visits with people. Here, we still have restrictions at the hospital with lockdowns, and I mean, we're out of lockdowns, but we still have restrictions with visitors at hospitals. I was only allowed 2 people on my list and only 1 at a time. And they had to be over the age of 18, so none of my kids could come visit me. But like, we thought I wouldn't be able to see my son for the entire time I was there. And my dad was kind of upset too because he wasn't on the list. Obviously, my husband was on the list, and then one of my best guy friends were on the list as well because my husband was on days that week, so he'd be working during the day and could come and give me anything I need at night. But if I needed something during the day, the only person really available was one of my best friends. So it worked out that way. So then once I was able to go outside, then I could have any visitors I wanted. They could come outside and visit. So my boys got to come visit. My one daughter came and visited one time, and my dad came to visit on Saturday. As soon as I knew I was able to go outside and visit, I called up my dad and I told him, and he goes, "I'll be there first thing in the morning." And he brought me Tim Hortons and we hung out for a bit, and it was great. So yeah, Saturday I had my dad visit me. My husband brought my one daughter and my puppy. Not puppy, he's 5 years old, but he's kind of a mama suck. So it was really cool to have him be able to come see me, although he was more interested in everybody around and not just me, but it's okay, I get it. And I ate a full sandwich again at lunchtime, and I even ate more for dinner. Pain-wise, still just the cramping, gas bubbles, that lasted pretty much the entire time I was there. And just all around tenderness. It was just soreness. Again, not painful, just soreness. Now this night, I'm almost positive I knocked my catheter loose while walking around sometime because I started feeling almost like this pinching down there. And they kept checking and said it was fine because my catheter bag was still draining, so I didn't knock it loose. But it was something I had never felt before, and it was bugging me for the entire weekend. But Saturday also was the first day that I did not have blood in my urine. My urine was actually clear. Not that you guys really care, but the entire week there had been blood in my urine, which was normal-ish considering all the work that had been done and the stent that was placed. But they were a little worried that it was lasting for a while. But Saturday, it was clear, good to go. And my stomach drain also started clearing up. That was when my stomach drain started becoming clear and not that pinky strawberry kiwi color that I explained. So Sunday, August 22nd, this is kind of where it's going to start getting repetitive. I mean, it kind of did back on Thursday. My husband brought both of my boys to come see me, and my mom even came to visit later on as well. Drain is still filling up a lot, but it was clear fluid, so they were kind of worried that it was still filling up so much, but because it was clear fluid, it wasn't like an emergency issue. As for my pain, it was the same crampy, normal, gas bubble type feeling that I had. Although this day I started feeling my normal twinges, like the pain I was having before surgery, and I was really, really worried that this whole thing was a waste and I was just going back to the beginning and it wasn't going to work, and I went through all of this for nothing. So first thing Monday morning, my surgeon came and checked on me like he did every other day last week. And he said that he thinks a lot of the cramping and the pinching and the gas type feelings that I'm having is caused from the stent. And he said since my drain and my catheter bag are clear, he said the stent can come out. And once the stent was out, I was able to go home. So I was so excited, just waiting on that. Well, then the urologist comes in and pops my bubble and says I can't have it removed until Tuesday. Originally, they said maybe I could go home Monday and then just come back to the hospital to have my stent removed on Tuesday. But my surgeon decided, like, you're here, let's just stay here the one extra night, keep an eye on everything, and then Tuesday morning you can go get your stent removed and you can go home. So I'm like, okay, one more night, I got it, whatever. I was ready to go home. I was going stir crazy, and it wasn't my bed, right? So I was ready to go home immediately. Plus I was feeling good. I was able to do everything. I was so independent. So I was ready. Another reason he wanted to keep me that one extra day is because he wanted to run some tests because my urine output had decreased over the weekend. And he just wanted to make sure that my kidneys were functioning properly. But all my remaining tubes came out on Monday, so my catheter came out, and that was super easy. The stomach drain came out and was very uncomfortable, very, very uncomfortable. But this did help relieve a lot of the cramps. The catheter coming out helped relieve so much of the cramping and pinching feeling. So I was feeling great already, and this just made it so much better. We started cutting down my pain meds because we planned on me going home the following day. So obviously I wasn't going to have those kinds of meds. So we took out my IV, and we were just doing oral medication. And so the discomfort kind of got a little higher, but I was pushing through it. It wasn't anything too bad.
Hey guys, editing me here. So watching that back, even I got a little confused by it. So I just wanted to explain, for pain meds, I was never on, I think the first day I was on like, medication through the IV, but then after that, it was always shots, pain shots, and the epidural. And then once the epidural came out, it was just shots. So then this last day, we actually stopped the shots, and I was just doing oral pill pain medication instead of the shots, since the shots are kind of stronger. So we were weaning myself off that way. And I was allowed to still have the shot at night if I needed it, which I did only need one. But yeah, so I was never on the IV medication. What I meant was I got the IV port taken out of my hand. But yeah.
Eating wise, I still hadn't had a full meal, but I was definitely picking more throughout the day, eating more of each meal, and I was doing better in that aspect. Tuesday morning, I woke up ready to go, got transferred over to the other hospital to have my stent removed, and then got brought back to a normal hospital. And the nighttime nurse was like, "Oh, you're back already?" I said, "Yep, ready to go home." And so my daytime nurse had overheard this, and I had most of the same nurses throughout the days and throughout the nights, but this was a new one. So I'm getting all my bags packed and stuff ready to go because my surgeon said, once your stent's gone, you can go. So I was all excited, ready to go. And my nurse comes in and she's like, did he tell you you can leave as soon as you get back? Because I have no notes on this. And I was like, well, not necessarily, but he said, once my stent's removed, I can go home. And she's like, okay, well, I don't have any discharge papers or nothing. She's like, so I'll wait and see if he comes and checks in. I'm like, okay. So it was like a couple hours later and still nothing. So I asked her, I'm like, I walked up to her, I'm like, can we call him? Because the way he was explaining it to me, he thought the stent removal was going to take a lot longer than it was. He thought I was going to be sedated and everything like that. And so I think that's why he hadn't checked on me yet. Because in all reality, the stent removal literally took a minute, like 60 seconds in and out. So she's like, yeah, I think that's what it is too. So she called him. And he ends up calling my room. He's like, are you ready to go home? I'm like, yes. He's like, okay. So thankfully, I got discharged and I got brought home. So Tuesday when I got home, I had this bed set up in the computer room. We had planned to have this set up before, like when I was getting all my preparations ready. This was one of the plans to have this set up because our room right now is up in the attic and that was a lot of stairs. I didn't think I'd be wanting to climb all those stairs, and I was right. Like there was no way. So as you saw at the beginning of the video, I had picked out all my jogging pants and loose fitting shirts and all that. for my husband to pick through. So that he had that down here in this room. So I really didn't have to go upstairs at all. I just hung out on the couch, snuggled with my puppies, and I had my bed ready for me whenever I wanted to go to bed. Pain-wise, still just really sore and not even uncomfortable, just sore and tender. But the pain I was having before surgery seems to be gone completely, which I'm so thankful for. I was still getting my twinges here and there, but my surgeon said that can take a couple weeks to even a couple months for that to fully go away, since everything's still healing. I'll insert a picture right here of what my incision looked like on the day that I got home, because that is when I planned on having this video finished. But I'm kind of glad I didn't, because there has been a couple things throughout the last couple months that I want to add on to. So I got home on Tuesday. That Thursday, my kidney pain really, like my left side where my kidney is, really started to hurt. So I wasn't supposed to see my surgeon for 2 weeks, but he ended up calling me in a week early because he was worried that I was having so much pain and discomfort, and sent me for an ultrasound and blood work. So then when I saw him that following week, my ultrasound looked fine. Everything looked fine. The bypass looked fine. Where the stent was looked fine. But my blood work showed that I did have a decrease in kidney function again, which I had right after surgery and the day before I was leaving. So he wanted me to repeat that blood work, and then check and see what's going on. Now, by the time I saw him the week after getting those tests done, the pain was gone. So we think my kidney function being lowered is what caused the pain, but we still don't know what caused my kidney function to lower. So I had repeat follow-up blood work done, and I haven't heard anything. So with medical stuff, no news is good news usually. I see him again in about, it's supposed to be at the 3-month mark, and I'll have another ultrasound, check the bypass, make sure everything's working, do blood work. And my family doctor also wants me to do a urine test just to make sure, because I always had the microscopic blood in my urine beforehand. So we just want to make sure that's done and over with and that everything looks fine. So this is my incision 2 weeks post-op. I was scared to take the steri strips off. That's my leg one. And then this is the next day when I took the steri strips off. So still 2 weeks post-op. So I went back to work 4 weeks post-op like he gave me. He said I might need more, possibly could be less, but not to push it, because, I mean, we fixed veins, right? And my job, I walk a lot. Walking a lot increases blood flow, which is with the veins. So he's like, don't push it, right? Because I am so skinny and so small framed, we think that might have helped a little bit with the recovery being so quick, just because I didn't have a lot of fat and muscle to cut through that needed to heal, right? So that's why it wasn't as bad for me, possibly. The surgery would have been the same, but the healing pain and discomfort, obviously I didn't have any of that. Going back to work, it was just more muscle tenderness and soreness. It was muscles I haven't used in a month. I've been laid up for a month, so I wasn't walking around and doing all that. So that's really all the discomfort or pain I had going back to work. Surgery pain, completely fine, besides this one pesky stitch, which I'm now I'm about 2 weeks out from being 3 months post-op, and this one stitch is still bugging me. For a little bit, it was literally poking out of my incision. So when I went for my follow-up with my surgeon, the nurse cut the part off that was sticking out, but I can still feel it on the inside. I literally just texted him or emailed him the other day, and I was like, is something wrong? Like, why do I still have this stitch? Aren't they supposed to be dissolved yet, like the internal stitches? And he said that they could last a couple months, and because I have no fat to hide the stitches, unfortunately, that's what's irritating me. And it just feels like it's trying to escape, like it's poking me from the inside, and it's so annoying. But besides that, surgery pain, non-existent. I also had some issues with nerve pain or nerve damage from the epidural. Pretty sure the anesthesiologist hit something he wasn't supposed to, because my the outside of my left thigh was completely numb still for a while. And even now it's still tender if I touch it. So my family doctor said that can take about 6 months to heal. So hopefully that goes away soon. And as for pre-surgery pain, or my twinges as I like to call them, they're still there slightly, but it's a fraction of what it was. Like before, it was 24/7, felt like someone was squeezing my right ovary. Now I'll still get the twinges, but they're not consistent. They're not 24/7. It's like a fraction of what it was before, and that could even still get better. My surgeon said it would take at least 3 months to even know what my future looks like. And even then it could still get better because the veins were so enlarged with blood. That blood now needs to figure out where it wants to go. Obviously they didn't drain those veins because that would be a lot of blood loss. So basically it's just the blood has to reroute and it has to figure out where to go. So that's why there's still some sort of discomfort that I was having before. But like I said, it is a fraction of what it was. And if this is my new normal and it doesn't get any better than this, I can deal with this. The urologist called me last week for my checkup, my follow-up from the stent placement. He said that looks fine. Everything looks fine from that. He wants to see me again in January, so an extra 3 months, and just repeat the test and make sure that everything's still working fine. So yes, there is a possibility. I know in these Facebook groups that I'm on, there have been, unfortunately, quite a few women that have had this surgery or something like this surgery and it failed. Down the road, 3 months down the road, 7 years down the road, whatever the case is. And of course that is a possibility. It's a possibility with any surgery. But it was the risk I was willing to take. I wasn't ready to do the more invasive surgeries just yet. If this does fail, then we'll cross that bridge when we get to it. But even if I have 7 months of feeling the way I am now compared to what I was, I'm happy with that. And like I said, we'll cross that bridge when we get there. I'm very happy with this surgery, very happy with the results. I'm glad I did it. Like I said, I thought it was going to be so much worse than it was, and it really wasn't that bad at all. Like, I don't want you to go into it thinking it's going to be a breeze. It wasn't. Obviously, it was uncomfortable. It was a major surgery. They couldn't open my entire abdomen. So it was a major surgery. So, of course, you need to expect some sort of discomfort and pain, but it was not at all unbearable. Like, I kind of tricked my mind into thinking it was going to be. And this is my incision today. I'm 2 weeks out from being 3 months post-op, so everything's healing up pretty well. This is my leg incision. This is the end of my surgery journey and my medical series. Like I said, I am going to do that awareness campaign that I've been talking about, but this is the end of my personal journey. If you are having this surgery or you are on this path, hopefully those other videos can help as well to let you know that you're not alone. I did post my hospital bag, what I brought to the hospital, what was needed, what was not needed, that kind of stuff. I'll link that down below as well, because I know when I was going in, I didn't find anything online about what I was going to need. So I will post that down below, and hopefully that will help you out as well. So I'll still be posting medical type videos, especially while I'm doing that awareness campaign, but I'm so excited to get back to my regular content as well. Thank you to all of you that have been so supportive during this entire process, whether you're my medical subscribers that have been following this journey to just kind of know that you're not alone and see what you're in for. When I was researching about this, when I was diagnosed and I was looking up for information, there was nothing online about it. So hopefully I can answer some questions for any of you that are going through the same process. Or if you're any of my non-medical subscribers who have been so unbelievably patient with my inconsistent content. Thank you, thank you, thank you to all of you. I promise I'm back. I'm working on quite a few videos right now, my cricket videos, my mummy videos, everything like that. So I am getting back into the swing of things. Thank you so much for being so patient. I mentioned in one of my other videos that I was going to do a giveaway when I hit that 500 subscriber milestone, and we have far surpassed it. We're at 615 now. So on my next regular non-medical video, I'm going to be doing a giveaway, and then of course a bigger one when we hit that 1,000 subscriber mark. So make sure you're subscribed and keep an eye out on those giveaways. Follow all my socials to get that kind of information before the videos come out. I'm really trying to be better at posting on socials. I've never been one to post like that, but I'm trying to get better at like Twitter and Instagram and just posting things more than just my videos. So be patient with me. I'm kind of learning as I go here. Like I just suck at staying on top of it, but I'm forcing myself to get better. So follow all of that and keep me accountable. Let me know, like, hey, you haven't posted in a while. Let's go. And please hit the like button on this video, because it will push this video out into the algorithm, so that if anybody else that isn't subscribed to this channel or even on the Facebook groups that I'm on is searching for this kind of information, this video can get pushed out to them, and hopefully they can get some answers that they've been searching for years. Like, this journey is so crazy. It is unbelievable what we have to go through to just get some answers. How many doctors, how many tests, and everything telling us that we're crazy, and it's all in our head. So I want this video, all of these videos, to hopefully reach people and give them some answers, and hopefully if they see it, they can be like, that sounds like me, bring it up to a doctor, and finally start getting a treatment plan after years of suffering. So please hit that like button. That is really what's going to help get this video out to other people. So do all the things. I'm very sorry if this video was kind of all over. Like I said, I'm getting back into the swing of things. I might have forgot how to video or how to film. But thank you so much for tuning into this video, as well as following the rest of my series. And until next time, stay foxy. Bye, guys.